What are the signs and symptoms of testicular cancer? How do I check myself for testicular cancer, and how often should I check? How do I know if it's time to see a doctor? If these are questions you've been asking yourself, then this is the video for you. Hi, I'm Mr Jaimin Bhatt, a consultant urological surgeon at Ross Hall Hospital, part of Circle Health Group. I have many years of experience in the diagnosis and treatment of male cancers, and today I'm going to be giving you some advice on spotting the signs of testicular cancer, explaining how to look out for symptoms, and also at what point you should seek medical advice. So, what is testicular cancer? Testicular cancer is any cancer that originates in the testicles, which are the male reproductive organs responsible for producing sperm and testosterone. There are various forms of testicular cancer, with the most frequent being germ cell tumors. This is by far the most common type of testicular cancer, accounting for about 95% of all cases. Germ cell tumors are further categorized into seminomas and non-seminomas, each with its distinctive characteristics. People at more risk of having testicular cancer are men who have had an undescended testicle and also men with a family history of testicular cancer. Although testicular cancer is a relatively rare disease, it is very significant because of its potential impact on male fertility. Commonly, people think of cancer as an older person's disease. However, most testicular cancers predominantly affect younger men from the ages of 15 to 40. This is why it is so important to be aware of the signs and to stay vigilant, checking yourself regularly so that any changes to your testicles are spotted early. Early detection of testicular cancer improves outcomes all around. What are the symptoms of testicular cancer? Spotting the signs of testicular cancer early means we can diagnose and treat the disease as soon as possible, which typically means a higher survival rate and a better chance of preserving fertility. The onset of testicular cancer can be subtle, so it's important to keep an eye out. The key symptoms of testicular cancer to look for include a painless lump or a swelling in either testicle, which is in fact often the first sign of this cancer. Some people also find their scrotum starts to feel more heavy than usual. You might experience a dull ache in your lower abdomen or groin area, and rarely pain. Another common symptom is a sudden buildup of fluid in the scrotum. In more advanced cases, patients can have back pain and even chest symptoms. These symptoms can all be caused by other conditions too, and so they aren't always due to testicular cancer. However, if you experience any of them, arranging an appointment to see a healthcare professional is very important. How can I check myself for testicular cancer? Early detection usually contributes to the treatability of testicular cancer, and I encourage all men to check their testicles about once a month for any changes or discomfort. So I'll now talk you through some simple steps to do a testicular self-examination. First, take a warm bath or shower as the warm water relaxes the skin of your scrotum, making it easier to feel any abnormalities. Now use one hand to support the weight of your testicles, and with the other hand examine each testicle in turn by gently rolling it around between your thumb and fingers to feel for any lumps, swelling or pain. I recommend to all my patients that they familiarize themselves with how their testicles normally feel and their epididymis, which is a soft tube-like structure behind the testicle, so that you won't mistake it for an abnormal lump. It's worth noting that the epididymis can have little lumps of their own called epididymal cysts. These are much more common than cancer and are benign. When should I seek help from a healthcare professional? The importance of regular checkups or self-exams cannot be overstressed. The better you know your own testicles, the easier it is for you to recognize changes. If you notice any abnormalities or experience any discomfort, schedule a consultation with a healthcare provider as soon as you can. In my experience, I have found that men are not great at seeking help in time, but it's really important not to be embarrassed about checking your testicles or seeking help from a professional, as early diagnosis can make all the difference. Thank you for watching this video. If you are experiencing any of the signs and symptoms of testicular cancer that I have discussed today, it's time to speak to a doctor. Visit your GP and they will perform an examination and can refer you to a specialist if they think there is cause for concern. Alternatively, you can use our online booking system at circlehealthgroup.co.uk to arrange an appointment with me in Glasgow or with another urologist near you. If you have any more questions about testicular cancer or any other urological condition, leave your question in the comment section below and we will get back to you as soon as we can. Thanks for watching.